you will go home tonight and you will look up on the internet how everything I have just said is wrong, okay? Why? Because people look at different studies done different ways. So how are we supposed to do scientific research? We can do anecdotal research, which means, for example, when they started using a drug called thalidomide over in Europe, they saw kids were born with missing limbs, which is a very rare thing to have, and all of a sudden it started becoming common, and they figured out it was from the thalidomide. So rare things becoming common. A drug called DES was causing cervical cancer in teenagers. Rare things are common. Or you can sit down and look at a bunch of hospital charts and say, here's the people that smoke, here's the people that don't smoke, who got cancer, who didn't, and you sit down and you do all the statistics and figure out what the risk of cancer is if you smoke or don't smoke. Or you can do an experiment, okay? You can give one state fluoride, another state doesn't get fluoride, and then you watch for years and see who gets cavities. Or you can give one person the drug and another person don't give the drug. You can make that better by randomizing it, meaning I don't choose who gets it. You just draw a number and you can actually get a computer program that tells you who gets drug A and drug B. And sometimes you can't do that because the patient's involved in the decision, and that's where a lot of these addiction studies come in. And then you can have a control group, which means you don't get the treatment, and that may be unethical if you think that all the treatments help, and we'll talk about that with a thing called Project Match. And finally, the most elegant one, the biggest one, is blinded, meaning I'm giving you a drug, but I don't know which drug you're getting, okay? And if the drugs look different, I give you both of them, and one's a dummy and one's real, okay? We'll talk about an example of that later on. So this is the ultimate study, is what we call a randomized, blinded, controlled trial, which is very rare in psychiatry. And the problem is that there are a lot of things you can't control, and you can't control that people know which medication they're getting. Or you can have something that's kind of fishy, there's something wrong with it, the way it was randomized, or in cancer studies, for example, one drug will make your hair fall out, the other drug will make you throw up, so there's no way not to know which drug you're getting. So that's where a study really isn't completely randomized and blinded. And this is where 95% of the studies that you read about come from. It's people sitting down with medical charts, interviewing patients and figuring out what causes what and what's the risk if you use this drug or use that drug. And then you get into the shadier area. 2C means there's no control group. So I give everybody here in the room vinegar, and I look to see what the incidence of alcoholism 5 years later, okay? And that's an uncontrolled study. Or you've got the hot air balloons, which is opinions of respected experts. And I can assure you I'm not one of them. But there's a thing called the Cochrane Database that I'm going to show you a couple of studies from. And if you want to impress somebody, you say, well, the Cochrane Database shows this. And the room will always get quiet because the Cochrane Database has spoken. Okay. The Cochrane Database is, I'm going to show you one big problem with it. It does not care about the finesse of the study. All it cares about is how rigorous the study was. So they will go through a bunch of studies on treating alcoholism and just throw studies out left and right because there wasn't the right controls or something. So when someone says the Cochrane Database shows this high quality studies, the good studies may actually be littered all over the floor, and that's very common.